Hello friends, in this video we will learn one reasoning question from cardiovascular system. Explain why beta blockers are no longer considered as first line antihypertensive drugs. So in the past, 4 groups A, B, C, D including ACE inhibitor or angiotensin receptor blocker, beta blockers, calcium channel block and diuretics. These 4 groups were considered as first line, but according to the JNC 8 guidelines 2014 and NICE 2011 guidelines, beta blockers are no longer considered as first line antihypertensive drugs. So first note that ACE inhibitor and beta blockers, both of them are most effective drugs for prevention of sudden cardiac death in post myocardial infarction cases. Means once the patient got an attack of myocardial infarction and then recovered. So in such patients, for prevention of sudden cardiac death, we may use ACE inhibitor or beta blocker. But in research, this was found that even cardioselective beta blockers monotherapy was less effective for primary prophylaxis of myocardial infarction and stroke. So the patients with primary hypertension without any compelling indication, beta blockers are not selected as initial antihypertensive. Hence, they are excluded from the first line groups. And also, there are other drawbacks of beta blockers, mainly of non-selective ones like dyslipidemia, the increased triglyceride level and also LDL to HDL ratio, the decreased work capacity and may cause feeling of fatigue because of blockade of beta 2 receptors in skeletal muscle blood vessels and also by decreasing glycogenolysis and lipolysis. Beta blockers may cause loss of libido mainly in male patients. And those beta blockers which can cross the blood-brain barrier, they may also cause CNS side effects like cognitive impairment including forgetfulness, then nightmares and even depression. Moreover, beta blockers are also contraindicated in bronchial asthma, chronic obstructive disease, peripheral vascular disease, in diabetes and even in cardiac conditions like AV block. So in short, whenever there is a compelling indication with hypertension like post-myocardial infarction patient or hypertension with stable heart failure or when ACE inhibitor or angiotensin receptor blockers are contraindicated like in women with childbearing age or when these drugs are not tolerated, then and then a beta blocker is selected as initial antihypertensive drug in young patients that is less than 55 years of age. So that's it for the question. Thanks for watching and stay blessed.